Today, we're going to be talking about loving your eyes. It's a theme for the World Sight Day, which was held recently on the 9th of October. We're going to be diving into it soon with people who have your sight firmly in their sights. Thank you, Dr. Oyeleye and Mary, for coming on the program, Mrs. Onu. It's a pleasure to have both of you here with us today.
Thank you.
Thank you. Thanks for having me.
Dr. Oyeleye, it's been a bit of a while, but we'd love to have you come and talk as a consultant ophthalmologist. We know you love the eyes. We know you love your eyes. We know you love all of our eyes. So can you tell us today, can you talk to us about loving our eyes, the theme of this World Sight Day?
Right. Thank you, Dr. Pamela. The World Sight Day is a day of global awareness about vision and vision-related problems. It's usually celebrated on the second Thursday in October, and this year it fell on the 9th of October, Thursday the 9th of October. And it's been, the World Sight Day initially started in the year 2000 by Lions Club when we had a first sight campaign, and this evolved over the years to become the World Sight Day. The theme for this year's World Sight Day is Love Your Eyes, and it's essentially to encourage people to look after their eyes, check for preventable visual problems, and make sure they're aware that there are solutions, and not to wait till they have symptoms before they try and address them.
So can you tell us a bit about what kind of preventable eye problems we're referring to here?
Okay. So the main one, which we could call preventable, is glaucoma. Glaucoma is the second most common cause of blindness worldwide.
Wow.
And what actually happens is that people do not realize when the disease starts, and it can go on for years before it has any symptoms. So you could have glaucoma affecting your eyes for years, and you don't know anything about it. And all of a sudden, you notice it and you think, oh, it's just come, but it's been there for years. And glaucoma is when the pressure in the eye damages the nerve at the back of the eye. And because the nerve cannot be repaired, this causes permanent visual loss. So for glaucoma, the most important thing is early diagnosis of glaucoma. We have other conditions whereby people need glasses and they don't have access to glasses. We call those what we call refractive errors. And imagine a child who needs to have glasses and doesn't have glasses, goes to school, he or she may not get the best out of their education. And then, of course, the number one cause of blindness is cataracts, which we all know about, whereby the lens in the eye gets cloudy and you don't see quite well.
So when we talk about loving our eyes, where did this, World Sight Day come from? What's the history of it?
So in 2000, the year 2000, there was a first sight campaign by the Lions Club. And there it was simply just to let people become aware. And it was done on the second Thursday, I think precisely the 9th of October in the year 2000. And then what now happened was it metamorphosized and it grew bigger. And every year we chose a new theme. Now, the Love Your Eyes, essentially, this theme was chosen first about 5 years ago, and it stuck on with everybody. So it's now essentially just to say, do something to protect your eyes.
And how do you think people can best love their eyes? What should they do?
The most important thing I would say is have regular eye tests. When you have your eye test, it's not just about getting glasses or not just about sight. It's about a detailed examination of the eye. So it's the most important thing. I'm thinking many of our listeners and viewers haven't had eye tests for a long time. So they should ask themselves, when did I have an eye test last? And if they haven't had it done within the last year, arrange to have that done straight away.
Now, some people ask, can I go to an optician? Do I have to go to see an ophthalmologist? Can I just go to anybody who is checking for glasses? Who do I need to go to have these eyes checked?
Okay, right. Thank you. There are many different professions who are parts of the eye care team. And the reason why I say team is that we all work together. The ophthalmologist is a medical doctor who specializes in eye care. And we do the comprehensive diagnosis and treatment of eye conditions. The optometrist also knows quite a lot about the eyes, and their main forte is looking at your eyes. And if you have issues like the need for glasses, they'll easily pick that up and do a test. But the optometrist can also look at the back of the eyes and see if there's a possibility you may have glaucoma. The people you shouldn't go to are the roadside opticians who simply are there to make glasses. They don't have enough specialized training to be able to examine one's eyes and tell if there's a visual problem going on.
Okay. So at least now we know where to go. How often should we be checking our eyes? And this is for normal people who don't really have a problem, who are seeing just fine.
Right. So let's start from childhood. The first eye test you have is when the child is born. The midwife or the parents look at the eyes and they see, yes, these eyes are open, and if there's any abnormality, they will know. Because some children, unfortunately, are born without eyes. So the first thing is at time of birth. And then before every level of education, preschool, that's pre-primary school, pre-secondary school, pre-university. And then when you get to adulthood, every 2 years, except if you have glaucoma in your family, then have it tested every year so that if there's a possibility of you getting glaucoma, it's picked up very early.
Wow, that's so important. Thank you so much for letting us know that. So it's every year if you have glaucoma. What about other conditions that affect the eye? For example,
If you have
diabetes or
family
something.
with glaucoma.
Yes, if you have
Yes,
someone in the family with glaucoma, you have to get it
that's
checked
right.
every year.
That's right.
But if you have some other condition, either yourself or in the family, for example, something like diabetes, how often do you have to get your eyes checked?
Right. So if you do have diabetes, the first thing or the most important thing is to get the diabetes well controlled. And that's done by your GP, who makes sure your blood sugar levels come down. During that process, your GP or family doctor will ask you to see an ophthalmologist for a review of the back of the eyes. If there is no problem with the back of the eyes, then you may be scheduled for either a 6-month or yearly appointment. Yearly, if your blood sugars are well controlled, and if they are not well controlled, then it'll be more frequently. And then, because diabetes is an illness, a chronic illness, you need to continue having this done regularly. In some situations, what we do is we just take photographs of the back of the eye every year, review the photographs, and if all is well, that's all you need to have done in terms of the check for diabetes.
Are there any other conditions that we should be aware of, the medical conditions that they say, if you've got this, go get your eyes checked? Is high blood pressure one of them?
Yes, high blood pressure is one of them. A lot of these circulatory issues can come. There are some diseases or the treatment of the conditions that could cause eye problems. Like there's some certain medications we use that could shoot the pressure in the eye up. There are some other medications we use that could make you prone to bleeding on the surface of the eye or inside your eye. So quite a lot of issues with what we call systemic illnesses affecting other parts of the body, could also affect the eyes. So you should be guided by your family doctor and be aware of that and have your eyes checked regularly.
Well, a lot of people don't have a family doctor. It's actually a real problem.
Yeah,
So you say be guided by your family doctor. They don't even have a family doctor. Most of them are just going to the pharmacy, picking some drugs here and some drugs there. Perhaps you can tell them why they need to have a family doctor.
okay. So first of all, a lot of pharmacists now, we're getting them queued upon referring people who complain of visual problems. There's some visual problems that they can easily identify and refer them to their ophthalmologist. Or if the patient complains about sight problems, they'll either say, go and get your eyes tested. Now, it's very important to have a family doctor because in situations whereby I said glaucoma, you don't have any symptoms, which is called the silent thief of sight. Hypertension is also known as the silent killer because you may not have symptoms and have quite a raised blood pressure. So hypertension is one of those things that silent, but unless you check for them, you may not find them. Luckily, the way things are now, a lot of people go to their pharmacists who have the blood pressure equipment to monitor the blood pressure. Or some people simply go to labs and say, "Look, I want a certain test done. I want a blood sugar test, and I want this done." But I think we have to be mindful of the situation we are and know that there are lots of health workers who could contribute in healthcare and get people referred for various conditions.
Yeah, thank you very much. Thank you, Mary, for coming on the program. Can you tell us your role in the Lions Club and why is Lions so big on site?
Well, my name is Mary Onu, and I'm the district governor for District 404A1, Nigeria. Nigeria has 6 districts, Lions clubs, and Lions are really big on site. It used to be a singular focus many years ago because we've realized it's one area that needs so much enlightenment and support. And we offer a lot of support, which many people still don't know yet.
So tell us a bit about the kind of support, the Lions gives to the blind and what you do about sight.
Okay. There's so many programs globally, not just locally, but we are concerned not just with fixing eyes, but preventing blindness. And that could be from all sorts of forms. Dr. Oyeleye has highlighted some areas where people are prone to blindness, which we intervene. We offer cataract surgeries. We offer cornea replacements. We've done a few in the past. Unfortunately, we're not able to do them locally within the country, but we do have cornea transplants where we take children or patients away to have their eyes replaced. We actually have an eye donor who has donated both eyes, and a member of the Lions Club. And till this day, he donated one each to 2 people. Until this day, both people see through his eyes.
Fantastic.
We offer cataract surgeries for free. We offer eye screenings regularly over the month of October. It's across our district. Our areas are parts of Lagos and parts of Ogun, but it's not just that, it's across the globe in the Lions Club International. We offer free screenings, we offer free cataract surgeries,
Now,
cornea.
I don't want to just jump in, but there
Yeah,
could be
no
somebody
problem.
listening to this program right now and says, you know what, I need help. How can
Yes.
they reach out? How do they find you?
Okay, we have a WhatsApp number where anyone can just drop a message, but
Can you
WhatsApp, not calls. It's
can you
0903-763-0045. I'll take that again. 0903-763-0045.
that's wonderful because these times are very hard.
Yeah,
And so people need support. And the loss of
absolutely.
sight is so, so, so crippling. And as you know, issues with disability in this country are very, very, very hard because not enough provision is being made for it.
We're
Is there
quite a
any
number as well.
Yes. Is there any work that you're doing in terms of the Land Club with in terms of policies regarding disability?
Oh yes, we have several areas. We're talking about sight today, but we do cover several areas, not just sight. We're particular about youth. Recently, we've just had an empowerment program with Faith Foundation. So there's so many things we try to bring to the fore, and that can only be done through these awareness programs we do very so often.
Yes. Yes. So, Dr. Ile, if I can come back to you, there was something that I read about river blindness and Lions Club doing something with river blindness.
Yes, there was a lot of work on river blindness over the years, and Lions Club was very, very instrumental in the research and the treatment because it was done all around the country now. And then we could say that river blindness has been eradicated now. So it's one of the pluses of putting a lot of people putting their hands together to make sure that a certain problem was tackled. And I have some of my colleagues or senior colleagues who were also very instrumental to this.
So this is a combination of many people, but Lions Club was particularly instrumental in it.
That's
So do we say kudos to the Lions Club for this stellar work?
that's right. Yes, yes.
Are there any other thoughts or any other aspects of issues with sight that you want us to talk about today?
The yes. Thank you very much. The key problem with sight is the access that people have to treatment and the affordability of treatment. One issue is, for example, the chronic conditions. I'm sorry I keep on going back to glaucoma, but it's one of the chronic conditions. For example, some people have to spend between 10 and 25,000 naira a month on glaucoma medication. And how many people can afford that? Let's be realistic. So it's one of the things, the access to eye care and then the affordability. I mean, rural areas particularly are underserved. I'm not saying we have it right in the urban areas, but I've done so many community outreaches in some rural areas, and you might go there whilst it's raining, and there are 500 people queuing in the rain just for
Oh,
someone to
wow.
look at their eyes. So rural areas are underserved, especially in Nigeria. But also, you see some people in the urban areas who can't even afford eye care and are just waiting for free programs before they have it looked at. And for chronic illnesses, the disease will progress down the line or progress down the line and then could lead to blindness.
So what hope do we have? Is there hope that AI or digital technology can come in and help us to tackle some of these problems?
Well, okay. For example, yeah, if you say digital technology, that's very right. For example, people set up clinics in rural areas, okay, and maybe they equip the clinic with a camera, and then somebody is there who is not one of the highly skilled medical practitioners. It might just be somebody who is trained to operate the camera, takes the photographs and then transmits the photographs to somebody in the urban setting. And then whoever it is can look at the photographs, make a diagnosis, and offer some form of treatment, or decide that, look, this person needs to be looked at more closely. So the use of technology is also very important in getting things done. And it also helps in our urban areas as well, because we are now detecting glaucoma much earlier now than we used to do 15, 20 years ago. So the earlier we detect it, as I said, the earlier we can start treating, and the more people are prevented from going blind.
No, that's excellent. I actually know, and this is a fact, that I know one of the doctors who's got a digital eye system that picks up cerebral malaria in children, and they're rolling it out. And they're planning to
Wow.
use it for diabetic retinopathy and other things like that. So this is something that is not something too distant, but something that's almost here. Now, unfortunately, time is fast spent. It's almost time to close. So do you have, if I can start with Mary. Mary, do you have any last words for our listeners?
Absolutely. I'll say a lot has been said on site, but do take advantage. The Lions Club has raised funds to make free screenings, free medication available. Look for a center in your neighborhood. It's a community-based association. Every community has a Lions Club literally across Nigeria. So take advantage, and it comes to you free, particularly in the rural areas. And sometimes, assuming we don't have a center close by or a club nearby, please reach out, because we need to expand to as many areas as possible to be able to offer these services free to the most to those most in need.
Thank you. Thank you so much. We appreciate it. Can you just give that number again one last time?
Absolutely. It's 0903 763 0045.
Thank you. Dr. Oyeleye, your last words.
Get your eyes tested. If one goes blind, it doesn't affect just the individual, it affects the whole family. So please get your eyes tested, not just for yourself, but for your family as well. Thank you.
Thank you.
Absolutely.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.